Periodontal or gum disease is the leading cause of tooth loss and may be associated with other chronic diseases, including diabetes and heart disease.
Dr. Richard Aguila, a board-certified periodontist with Jacksonville Dental Specialists, is here today as part of our weekly Dental Health Watch segment to teach our viewers about what periodontal disease is, how you can identify it, and how it can be treated. So welcome back. Thanks for joining us today.
Thanks for having me.
Let's just start with that question. What is periodontal disease?
Yes, periodontal literally means around the tooth. And what periodontal disease is, it's a chronic infection that causes destruction of the supporting gum tissue and bone around the teeth. Its primary etiology is bacterial plaque, and it usually manifests itself in a susceptible, genetically susceptible individual. So genetics also plays in a role. So what happens in periodontal disease is you get plaque buildup on the teeth, which causes the gums to become inflamed, red, and bleed. And there's a little diagram. And the gum tissue gets red, inflamed, and bleeds and detaches from the tooth. If it's left untreated, this bacteria causes the bone to actually recede. And this is called periodontal disease. Just like other chronic diseases, there's also other factors that contribute to it. Things like using tobacco, smoking, diabetes. Stress has been shown to contribute to periodontal disease. Grinding your teeth, certain medications predispose you to getting periodontal disease as well, and poor nutrition. And periodontal disease usually starts out, the first stage of it is gingivitis.
And you see that is a lot of like, fighting gingivitis when you see toothpaste and whatnot.
Absolutely. And this is the earliest stage, and there was a picture of it, and it starts again with the bleeding gums, the inflammation. And the nice thing about this stage, it's at a very treatable stage, and there isn't any irreversible damage that's being done. When the disease process continues and periodontitis occurs, that's when destruction of the bone occurs, and it's irreversible. And it's you've got mild to moderate forms, which is relatively early, and I typically get involved as a periodontist in treating the moderate to severe forms.
Wow. So talking about severe periodontitis, what is the prevalence of the disease? I mean, how common is it?
Yes, it's very common. The Centers for Disease Control estimate that 1 out of 2 Americans have some form of gum disease.
1 out of 2?
1 out of 2.
Wow.
Yes. And to be specific, there was a 2009-2010 study that showed the prevalence of periodontal disease to be about 47% that have mild, moderate, or severe forms. And it's one of those diseases that becomes more prevalent as we get older. The same study showed for adults older than 65, the prevalence is up to 70%.
Wow. Wow. So listen, if left untreated, this could lead to worse health effects. You know, just like we say obesity will lead to other
diabetes, chronic disease.
Right, exactly. Is this the same thing with periodontal disease?
Exactly. There is a lot of research going on in the periodontal residency programs throughout the country, throughout the world, that are trying to find out the association or the correlation between periodontal disease and systemic disease. The past 10, 15 years have shown strong research that definitely shows an association between periodontal disease and heart disease, periodontal disease and stroke, diabetes, respiratory diseases, kidney diseases, and for women, risk of preterm delivery or low birth weight as well.
Wow. Wow.
So let's talk about how we're treating it, because you said it's irreversible at some point, right? Is that once it's in the gingivitis stage, it's treatable?
It can be treated,
okay.
But and there's different ways it can be treated.
So
we always try to be as conservative as possible. Okay, it starts out with scaling and root planing, where we go below the gum line, remove all the deposits that accumulate on the roots. We also use medications or chemotherapeutics, where we use antibiotics as well. There are when it gets to the advanced stage, there are 2 basic ways that advanced periodontitis is being treated. There's a traditional approach where we make incisions, we reflect the gums back, we get everything clean, and then we stitch the gums back to place. This works, but it's pretty painful.
Okay.
and patients are very sore, but it is still considered the gold standard. At Jacksonville Dental Specialists, we actually use a laser to treat gum disease. Okay, the actual laser we use is the Periodontal, and it's the only FDA-approved laser for treating moderate to severe periodontitis. We've got a brief animation here, and how it works is it's minimally invasive. Okay, we have to numb the area up. Instead of a scalpel, we use this laser, and the laser is placed into the pocket, and the laser removes the diseased tissue from the pocket and also removes that bacteria that we talked about as being the etiology.
And so this will then save the tooth?
Yes,
Yeah.
it will help save the tooth. After the laser is placed in the pocket, we do a good debridement and cleaning of the roots with our ultrasonic instruments.
Wow.
Okay. Then we reapply the laser to create a clot or seal that forms around the teeth. And what we're trying to achieve is reattachment of the gum tissue to the tooth, which causes the gums to tighten up around the teeth, which gives it cleansability and less likelihood for the disease process to continue.
So let's compare this new sort of procedure using this laser to the gold standard procedure you talked about a second ago. And that you said was very painful. This
Right.
is something that's less
Yes.
painful.
Yes, the biggest advantage for the patient is it's minimally invasive and a lot more comfortable. We don't even require sutures because the laser causes the hemostasis, and a lot of times my patients don't even require medications afterwards as well.
Wow.
So it's really changed how periodontal disease is being treated today.
All right.
Great.
Dr. Aguila, thank you so much for walking us through all of that. And thanks so much to Jacksonville Dental Specialists, of course, for sponsoring this segment.
Yeah, call 904-460-4201 today to schedule a consultation or visit their websites to learn more at MatthewNawrocki, DMD.com or RichardAguilaDDS.com.